Chapter 13, Water-Soluble Vitamins, Screencast 4. The next water-soluble vitamin that we're going to address is niacin, which is also known as B3. Niacin is primarily found in proteins. So example, it is found in poultry, meat, fish. Notice the bread is enriched, mushrooms, and peanuts. Now, one thing to keep in mind here is niacin can also be synthesized from tryptophan. The issue here is you need quite a bit of tryptophan, approximately 60 milligrams, just to make 1 milligram of niacin. Now, protein is approximately 1% tryptophan, so 1 gram of protein actually provides 10 milligrams of tryptophan. Niacin actually exists in two forms, nicotinic acid and nicotinamide. Both forms are used to synthesize niacin coenzymes. Previously, we talked about nicotine dinucleotide, or NAD+, and another one would be nicotinamide adenine dinucleotide phosphate, or NADP+. We looked especially at NAD+ in the role that it plays in glucose oxidation. Now, here we see quite a few sources of niacin. And if we look at some of the best sources, they tend to be protein, except for looking at product 19. But remember, this is a cereal that's actually fortified. Here we look at chicken, tuna, halibut, and they all are really, really good sources of niacin. Now, this is something that we have seen previously, and when we look at the coenzyme forms of niacin, primarily NAD+ and NADP+, we know that it is required for the metabolism of carbohydrates, proteins, fats, and alcohol. And we know that NAD+ is used so that we can actually form NADH and electron transport molecules. Now, if we look at pellagra, this is a niacin deficiency, and it includes quite often symptoms that are called the big threes. And those are going to be dermatitis, which is a rough red rash on the forearms, backs of hands, the face and neck, diarrhea, and dementia. There is a fourth D, death, if this goes untreated. Another thing that we have talked about previously is the use of niacin as a pharmacological agent. High-dose niacin has actually been used for many years to increase HDL cholesterol and lower triglyceride levels. Unfortunately, recent research does not support the use of niacin in this particular manner. Niacin-containing medications are no longer recommended for most individuals that have cardiovascular disease.